y'all. I can talk about Okay. I'm AJ. Just call me AJ. So y'all learning some stuff about mental illness in a book. 2012 version. Should I give you the truth? True. Okay. I'll do truth. Let's see. 35. And to kind of piggyback off what Pearlie said, I'll take it on this angle. Treatment and recovery is important because diagnosis is so hard to come by sometimes. And that's just the way of the system. Obviously, you have places like Dorothy Dix that have closed. You hear facilities losing money, group homes losing money, right and left. What the majority of them remaining are in Burlington. Okay, so if you go back and you do a little bit of history, you're thinking upwards of maybe 10, 15, 20 years worth of trauma. Homelessness, abuse is a common thing, but maybe getting treatment within the last 5 or 6 years. Okay, so I've gone close to 30 with the drama, 30 without diagnosis, and more importantly, 30 without meds. So if you get a response phone call, whether that's officer or security guard or anything like that, it's no telling what's on the other end of the phone. But what I tell people always, just think of what theatrical person was on the other end of that call when you got it. I'm thinking, okay, this person is coming to help me. You're thinking, okay, I have to protect and serve, I have to save the day because we got a crazy person over there on the other side. And more than likely, that's just Hollywood sensationalized drama. You're probably coming to talk the person off the couch, not the window ledge. You know, you're probably coming just to say, okay, what's wrong? Do I need to take you in to save the taxpayer dollars and, you know, to be frank, lawsuits? Because what happens, I have ADHD, for example. Okay, so I'm always fidgety. I always can't sit still. I'm all over the place. But as an officer, you figure, okay, I can't see her hand. She's making me nervous. Everybody's on 10. I need to react. I'm not thinking you're coming to help me. Small things to diffuse, de-escalate, and bring everybody back down to zero only takes just a couple of steps. You're saying you're coming to help. I'm thinking, okay, how's this medical help? I see a firearm, I see some cops, I see lights flashing, that walkie-talkie thing that just works in my lap. When that is on full volume, all of that is going on. It's just making me even more worse. Not being trained in any kind of mental health education, you probably wouldn't know that. You're probably thinking, okay, this person's probably guilty, they're up to something, that's why they're being nervous, I need to be on guard. And it's the total opposite. So just small little things like that, you know, will really diffuse the situation. And then at least with this CIT, with this training from some of the CIT officers, I live in Chapel Hill, I've heard in Chapel Hill, they said, you know, they've gotten those calls maybe lessened and more handled by a good 20, 30 minutes by just standing there and listening. It's kind of like daycare. The lower and softer you speak, that other person eventually will calm down, even if you don't kind of get what's going on. What's your name, sister? I'm sorry. Shalisha. I was just telling this lady here, but right before I got here, I was reading something on Huffington Post, maybe a couple of weeks ago, about a schizophrenic inmate who killed himself. And he was saying he was hearing voices, and of course, you don't know who's pulling a crazy fence, and you don't know, you know. But he said he was hearing voices, this is why he did what he did, and then he abused himself horribly when he was behind bars. I said, okay, attention or not, I don't know anybody who would fake that. You know, he started cutting himself, he started shanking himself. Eventually, he had a homemade shank that he might have stabbed 4 or 5 really deep puncture wounds into his genitals before he hung himself. So that's faking. Either you are one hell of a magician or you really are bored. You know, it's these things about mental illness we don't understand. Our prisons are our biggest hospitals, and it shouldn't be that way. I wish I could find an ad. It was a Huffington Post ad about a schizophrenic Puerto Rican young man earlier this year who killed himself. But one thing that jumped out at me, one of the CEOs said, we're not trained how to deal with this. We're not. We can stop a bleed. We can perform CPR. We're not trained in mental illness. We're here to house people. So if for the medical thing that is wrong with me, I'm being punished like I'm a criminal, it didn't help the situation either. You know, so for me, what helped was these here engagements that I do and getting on a right regimen of medication. Now, there's a couple of different things going on. Okay, I told you it's ADHD and all the rest of the alphabets. They say I'm schizophrenic. A couple of people at Freedom House that seem to think so. UNC seems to think I'm an addict, which I'm not. You know, no matter how much blood work they get, they still think that. I have been diagnosed bipolar for a couple of years, and just all of the other alphabets. So it's very difficult to function sometimes, but it still doesn't take away from me as a person. You know, we're using a criminal system to deal with medical matters, you know, and I've never been behind bars. Now, I've been at Fort North, I've been over at Duke, I've been a Butler. I said, you see what y'all keep doing to me? I need treatment, but you lock me away. That's not helping, you know. And I said, really, besides the diagnosis, I'm no different from anyone in here. I finished undergrad, I'm in grad school, don't ever do that on purpose. I live alone. I take care of myself. I do get disability because it has interrupted work, especially in not being able to concentrate. Did she let you out the house wearing that tie this morning? I'm sorry, it's ADHD. You did that by yourself.
That was just for you.
Okay, I'm sorry. It's the attention deficit, y'all. But you know, I'm a fully functioning person most days, depending on who you ask. But the way to deal with me, and I guess anyone with mental illness, is not to lock us away. Something a Chapel Hill CIT officer I was talking to last week, he said, you know, Orange County isn't going to make a habit of making sure that you have your meds once you're behind bars. It's going to DT and get worse, you know, and granted, because it's there for a correctional purpose, not a medicinal purpose. So nobody's really putting on their priority list to make sure you have your meds 3 times a day, that you eat before you take your meds. Nobody's going to walk in there and give you a journal so you can write down your feelings and, you know, vent in a creative way rather than hurting or shaming yourself. Nobody's going to make sure that you know, keep up with that therapy appointment. The other cops know that you're behind bars. It's not there for medicinal purposes. But by all of those things lacking, this is how someone gets worse. You know, it's I won't say it's an easy road, but eventually you can get back on that path to wellness. Help out a few folks. I can teach, I can, you know, do all of these different things. But if I'm not being allowed to take my meds, if nobody hears my side of the story, if you walk in thinking that, okay, this person's guilty, this is a criminal matter, that sends me right back to day one. It sends me right back to day one. And, you know, you kind of have to step outside of, I'm guessing, the number one way you've been trained to think since back at the academy. Everything or everyone is a potential or probable threat. You got to think safety. And with mental illness, it's not the case. Half of what you see on TV about, you know, the folks who jump off buildings and burn things down and, you know, shoot Uzis into people, that's probably the minority. It's not the majority. Now, granted, I'm all over the place some days. I understand that. But, you know, it doesn't mean that there's things that cannot be addressed. And it doesn't mean that I'm necessarily violent. Now, as far as, you know, my special shirt I made for my ex-boyfriend, that's just me venting. That's me venting. That's not me being violent. But, you know, I give you like a really good example. I know that the hospital system, the healthcare system in this country is trying to get away with just pulling out a needle every time a patient acts up. You know, then doesn't really look good, and it doesn't say that there's a creative or more effective way of going about things than doping someone with a really strong tranquilizer. However, if that nurse can get to me before security can, I think that might be a smart idea or a little exception, you know, instead of, okay, I'm combative, whether it's off my meds or not. For whatever reason, I just happen to be combative. This was just a couple of months ago. Okay, they decide to call the goon squad. All 5 of the little 5-0 security people. And before they did that, they had me in 4-point restraints because they said I was just, you know, a little too unstable. Okay, fine. What does not help in that case, especially when you deal with women, more than likely there's an abuse history there. This is what I mean about going into a situation and thinking, you know, thinking about this thing from all angles. I'm strapped to a gurney, nobody's listening to me, blood pressure's already through the roof, medication obviously is not working, I'm in 4-point leather restraints. Now here comes 5 people just rushing at my bed to save the day. These are 5 men rushing at my bed, and when I'm strapped down, I'm thinking flashback. Number 1, I'm thinking you're trying to hurt me. As a responder, you're not thinking that, but again, this is what I mean about looking at things from all angles. No, I can't stress it enough. Be mindful of who you get the call from. Won't mention any names, but some agencies have had the habit of saying, you need to go to this person's house. They're a threat to society. The world is going to burn down in 5 minutes. It's going to be all their fault, and they're going to be sitting on top of a pile of rubble singing It's a Small World after all holding a match. That person, yeah, they don't help the situation any. You know, you might want to show up and try to figure out what's wrong with the person. That lower tone of voice, all those lights flashing, 86, that not instructing everyone that came with you not to draw anything, that helps. That loud walkie-talkie thing with the static noise is a big trigger for me. Small things like that. And then by the end of 5 minutes, you're like, oh, okay, this is all we needed to do. Now, that person may or may not be violent, but right about then, you can assess that situation for yourself. Instead of, you know, constantly wasting taxpayer dollars going out to all these phone calls that someone, 911 access somewhere said was a big threat. You know what I mean? It's really easy. I'm functional. I still in recovery. I still sleep 2 days a week. I, you know, do the best I can as far as living alone and with school and all of these different things, and trying to speak at trainings like this, so, you know, y'all get it. And then, like, I won't have to see Captain Bates or anyone else in Chapel Hill at all. Like, can I get a word in edgewise? No, but I got the call and they told me, and who responded to the call? That's all I know. I have a special, don't raise your hands, I have a special announcement for rookies. If you just graduated from this program, or you just got in uniform 2 days ago, don't answer these calls. They are highly specialized. I don't know of a police department in the country that would send 2 recent grads out on the call. I'm guessing that's not typical. You probably have to go with a partner who's been at it a little bit longer than you. Maybe? Okay, maybe, in a perfect world. But without experience in crisis calls and diffusing situations, that might not be a place for the recent grad. You know, like I said before, I can always tell a rookie because I smell graduation on their breath. You know, they like to show up and, wait a minute, I got it. No, we're going to take this person in, and they're wrong. But the 911 operator said, you ain't do this yet. You didn't do this yet. You know, so it's just all about how you handle things and how you approach the situation, what you communicate to your fellow officers, and more importantly, realizing that this is a diagnosis, but I'm not a diagnosis, okay? I have a label, I'm not a label, and I guess we all have crazy potential. You know what I mean? I guess we see it in law enforcement as well a lot often. But there's a way to handle these calls. There's a way to respond to these things and to continue on in your training so that you can understand it's not a crime to be mentally ill. It's not a crime to have a mental health diagnosis. There is a difference, just, you know, about changing the rhetoric between mental illness and having a mental health diagnosis. Illness, in my opinion, implies, you know, dependence. You need someone to take care of you. You can't function because you're always sick. Me, I just have a couple of diagnoses. Okay, I have 4. But, you know, I have a couple of diagnoses. You know, and it still doesn't mean I can't function, you know. I live every day, no different than all of you. I got special projects I'm working on here in the community. I do different things for different churches. I'm getting better. It has taken 30 years to finally figure out what the heck is going on. In a minute, I'm going to invent new currency to pay at least 2 practitioners to finally agree on something. But at least I'm medicated, you know? At least I'm medicated, at least I'm getting better, and at least, you know, we have people in the community who are taking these types of trainings. So you can just understand. It's not, I guess, as dramatic as sometimes it may seem. You know, you have those, granted. You have to think quickly. But often, that's not the case. It's not the case at all. You just need someone to listen, you know, like anybody else who's upset. The last thing you want to be met with is confrontation. I'm trying to talk, she's trying to talk. I'm like really dead set. I'm happy to be breaking up with you and you're still trying to talk. And then, you know, if you just kind of pull away from the situation, be mindful of who you got that phone call from, diffuse things before everybody's on 10.
Sorry, you're fine.
Y'all know I'm attention deficit. Like, I said this, but yeah, you know, instead of using, again, and budget cuts are all across the country, but instead of using this criminal means to deal with a medical matter, it's better if we get more medically trained in order to push these efforts a little bit more and to improve them as we go. The hospitals, excuse me, the prisons will be used a lot less as hospitals, and then you have more and more staff, hopefully that will spill over from the police departments to prison officials in how to deal with this, you know. And it's not easy. I hope y'all haven't been afraid since y'all been here, you know, and we haven't frightened anyone away, but it's definitely doable. I don't like handcuffs. You know, I don't like noises. I don't like being hauled off to anywhere. I just got out of UNC last night. So, you know, you have to think when you mention that word help. Again, if you think you're coming to help me, the last person that said that, I ended up on 4 North. You said you're coming to help me. You think you're doing your job, you know, perfectly, you know, expectable. But last person that said that, I was in Durham region. Or but, how are you medical help when you show up with a firearm and handcuffs? You know, kind of look at it that way, almost like a parent with a distressed child, and just listen, bring everything down on 10, from 10, and then you'll start to see that this is really doable and working with the mentally ill. Okay, that frightening enough? Okay.